While many countries are focused on preventing a second wave of COVID-19, others are still very much struggling with the first one. I'm going to bring you updates now from across Latin America, but we'll start with an update from India because cases there are surging. The latest daily tally is over 16,000 new infections. That's the highest figure yet. In total, nearly 500,000 people have been infected. That's the fourth highest in the world. And over 14,000 people have died, over 400 in the last 24 hours. Now, the majority of these cases are in three states: Maharashtra, Tamil Nadu and New Delhi. There's a particular focus on the capital, Delhi. A quarter of all new cases in India are there at the moment. We've seen buildings being transformed into makeshift hospitals. For example, this used to be a spiritual centre. Now it's a COVID isolation facility with the capacity for 10,000 patients. Here's more from Yogita Lamai.
There is increasing alarm about the rising number of coronavirus cases, particularly in the national capital. In response, the government of Delhi has said that they will screen every single home in the city by the 6th of July. What this means is that people will be going door to door to people's homes. They will be screening if anyone has coronavirus symptoms like fever or a cough. In other parts of the country as well, the southern city of Chennai, for example, a lockdown was reimposed a few days ago because of the rising number of cases.
So many concerns about Delhi. Mumbai, though, is the worst affected city in India. It has more than 60,000 infections, and of course that's putting a huge strain on its hospitals. The BBC's Mahesh Konor has been given access to an intensive care unit in the King Edward Memorial Hospital. That's one of Mumbai's best-known hospitals. Here's what he saw.
Intensive care unit.
These are the 15% with serious symptoms. The ward is calm and quiet. With relatives in quarantine, patients in the unit are alone. The doctors here are their only link to the outside world.
The family of the patients cannot be here. They don't even know what is the exact condition of their family member inside the ICU. This has increased mental stress for both patients and us. Because we meet the patients every day. We become their only immediate contact.
But it's not just the patients who have the virus. Dr. Vajpayee and her family of 9, including her 1-year-old twins, have all had it too. She got infected in April.
Since last several hours, there is no staff nurse in this ward.
Many doctors have struggled to cope. In another part of the same hospital, feeling overwhelmed and understaffed, resident doctors have been filming the wards and posting videos on social media.
I am feeling helpless right now. I can't do anything. I can't let person die in front of my eyes.
Extra staff have been brought in to help the doctors since the video was made public. But their boss says scenes like these are common in state-run hospitals like these.
When you say our hospital is crowded and one bed is shared by 2 patients, then you will find such situation in private hospitals as well.
The monsoon season is just beginning in Mumbai, and that means the health workers are now faced with 2 challenges: treating seasonal infectious diseases such as malaria and dengue, and fighting the virus.
Well, from India to Iraq, and early on in this pandemic, we thought perhaps Iraq had been spared. Unfortunately, that's not the case. In the last 24 hours, it's reported over 2,000 new cases. That's a new high. Its overall total is 36,000. You can see from that graph the general direction of travel. This is a field hospital that's being built in Baghdad. It has more than 500 beds, but of course that's just a start. Local doctors have told the Middle East Eye the pressure on the health service is extremely high, with the short supply of oxygen a particular issue. Also, a spokesperson for the charity Doctors Without Borders has said provision of services in general had been almost chaotic in some areas. From Iraq to Armenia. It's one of the worst affected countries in the Caucasus region. Such is the concern about the rising cases here. The WHO has sent a team to investigate, and these are the figures. More than 21,000 people have tested positive, more than 300 people have died, and that's out of a population of 3 million. Now, Armenia did have a lockdown, but it was lifted at the beginning of May, which was still when infection rates were going up. From these pictures, you can see People did go out, but there wasn't a huge rush to return to the cafes and restaurants. Well, during the lockdown, Armenia's economy took a huge hit. The government says that in April, it shrank by 17%. And that's the statistic that is central to the government's insistence now that it won't reimpose the lockdown. Here's the Minister of Health.
We don't have an end goal to eradicate the virus because it's not possible. We can actually put this goal in front of us and let's eradicate it. But we have to have closed borders, I don't know, for years, maybe closed businesses again for months and years, and we will die from other causes actually.
Many people don't buy that, though. The Prime Minister and the government is facing a barrage of criticism. Here's the BBC's Caucasus correspondent, Rehan Dimitri.
This is the country's Prime Minister, Nikol Pashinyan, visiting a frontline clinic treating COVID-19 patients. How many beds are vacant, he asks. The chief doctor says it's tough, there are just 3. This video, allegedly of a wedding party hosted by the country's top army general, gave many Armenians the impression that the government has not been taking the crisis seriously. The following day, the Prime Minister sacked the general and other senior figures. But that hasn't satisfied Armenia's political opposition. It has been calling for the entire government to resign over its handling of the pandemic. Armenia's infection rate per million of population is one of the highest in the world.
What the government's policy towards fighting the COVID-19 would be called is a disaster. They have failed completely, and that's why Armenia has found, unfortunately, itself in the line with a couple of other countries in the world with the worst figures and the worst statistics and the worst dynamics.
Nikol Pashinyan owes his leadership to the Armenian public, who brought him to power in a popular revolution 2 years ago. Now faced with the biggest challenge of his premiership, he is relying on his people once again to do their part to fight the virus.
Well, from India to Latin America, which is under pressure too, combined with the Caribbean, deaths from the virus have now passed 100,000. And we're told the virus has not even peaked in that part of the world. Here's the WHO.
We've seen a steady and worrying continuation of trend, with many countries experiencing between 25 and 50% rise in cases over the last week, which means many countries in Central and South America and in the Americas in general are still suffering sustained community transmission.
We've talked a lot about Brazil. Deaths there account for nearly half of all the fatalities in Latin America. These latest pictures detail the stark reality of what's happening there. These are row after row of new graves being dug in Rio de Janeiro. Over the last 4 months, there have been over 1 million confirmed cases in Brazil. Mexico, too, is being badly affected. It has over 190,000 cases and over 23,000 deaths. It also has a low rate of testing, which means that the figure may well be higher. And there are other challenges, too. This hospital in Mexico City had to be evacuated when a powerful earthquake struck on Tuesday. Also wanted to mention these triplets. They're only 3 days old. The babies, 1 girl and 2 boys, were tested for the virus within 4 hours of being born in San Luis Potosi state. Their tests came back positive. What's puzzling their doctors is that both their parents' tests came back negative. While 2 of the babies are in a stable condition, 1 of them's being treated for a respiratory condition. I'll speak to Rafael Rojas from BBC Monitoring, live with us from Miami. Rafael, let's talk about Mexico first. Help me understand what its strategy is to take on the amount of pressure being exerted by the virus.
The situation in Mexico continues to be the situation that began when the pandemic hit the country. The Mexican president, Andrés Manuel López Obrador, has continued insisting that Mexico has already peaked in the number of cases, even though the number of deaths, as you were initially saying, has climbed to over 23,000. The government insists that the situation is not as dire as the media is playing it out to be.
Also want to ask you about Chile. We've talked a lot about Mexico, Brazil and Peru in the last few days, less so about Chile. Tell me what's happening there, please.
So Chile has currently over 250,000 cases, over 4,700 deaths, and the situation there continues to be problematic because the numbers are rising. The government is trying to keep under control the situation, but in Chile, as in Peru, there is one big problem that analysts find, and it has to do with job informality. People have to go out of their houses to the streets to find food, to find money, to provide for their families, something that the government has been unable, the governments in Peru and Chile have been unable to grapple.
And given the different problems across the region, I wonder, is there any regional coordination, or does each country make its own decisions about this virus?
So far, there has been cooperation between certain countries. Of course, the political situation between several of those nations, being the left-wing government of Venezuela or the right-wing government of Brazil, has complicated matters to such an extent that the border between Venezuela, Brazil, Colombia, and Peru has been one of the most affected places because of this coronavirus.
And lastly, I must ask you about Brazil. The figures are incredibly shocking at the moment. BBC Monitoring focuses on media coverage that we see in different countries. How is the media treating this story in terms of President Bolsonaro?
The media has been increasingly critical of Bolsonaro, even from the beginning of his mandate. But the coronavirus crisis and his refusal to acknowledge that there is a problem, the situation in which the two people who have been responsible for the response of the coronavirus crisis have been sacked, that situation in the media has played out with intense criticism. And it's very difficult to find a media outlet that defends Bolsonaro's position.